Welcome to St. Petersburg Together. I'm your host, Janice Ford. People have always cared for their relatives' children. However, most have done so with little formal help. Over 6 million children in the U.S. are being raised by a relative, primarily grandparents. Many right here in St. Petersburg and throughout Pinellas County. One organization aimed at supporting these families is Kinship Care. Joining us now to talk about the support group is Tara Ofosu and Larry Cooper. And thank you for joining us today.
Good morning. Good morning.
Good morning. Why are there so many grandparents raising grandchildren today?
Well, there's a variety of reasons. We've seen over the years, many times it had been a parent who maybe had been ill or maybe mentally ill, maybe some financial instability, and the family was living together, and then the grandparent maybe stepped in to play the primary role as a caregiver. But as child welfare has gotten more formalized over the years, they've called on grandparents and relatives first rather than those children entering into foster care. Right. So it's really a growing number of relatives around the country that are stepping in to take care of those grandchildren.
I know my background before coming to starting working here at the city was social services, and we used to see a lot of grandparents that would, rather than see those children go into foster care, they would take those kids on, and they really didn't get any kind of formal help. It was just, that's my grandchild, I'm going to raise him, and I don't care if it's 1 or 6. They took on this responsibility and they did not get any help. But it's a little bit more to it now. For those grandparents who are still taking on their grandchildren, but those kids aren't in foster care, so you provide some services that they can apply for.
Right.
Okay.
And luckily here in Pinellas County, the Juvenile Welfare Board saw that there was really a need countywide. There's about 15,000 children living with relatives here in Pinellas, so they wanted a formal system to support these relatives and really make sure that they have the supports that they needed to make sure that those kids were successful and that the kids did stay out of foster care. Many places around the country have no formal supports or availability of any resources for relatives. They place with a relative and wish them luck.
Right. Now, what kind of sacrifices does grandparents make?
Financial is the biggest sacrifice because a lot of them are on fixed incomes and not working. And so they have to find food, clothing, school supplies, and a lot of times that's difficult on their salaries. So financial is the biggest sacrifice that they make, and then their time. They haven't raised kids. A lot of them, their children are grown, and they haven't been raising children, and now they have to. A lot of the relative caregivers, myself, I found out about this program being a relative caregiver. I was 26 years old. My mom just passed away, and I took in my brother and my sister, and I was newly married. So that took a big toll on my life, being 26 years old doing that.
Wow. Now let me ask you this. If a grandparent takes on the grandchildren, and without those kids being in foster care, can they apply for assistance as far as food stamps and things like that?
Yeah, and that's one of the biggest things that they don't even know about, that nobody educates the community on, is that even without legal custody, but if they're the primary caregiver, they can apply for these public benefits, like you said, the cash assistance, food stamps, Medicaid, and insurance, so they can get those basic needs met, safety and well-being of the children that are in their care.
Right. Now, I know that we will have some information about contact on our scroll, but give us your website or phone numbers that people could call you, or either go on your website and get information.
Absolutely. The best number to call is our intake line, which is 1-888-920-8761, and then our website is children'shome.org, and we have a Kinship page set up for caregivers to find out about local resources, how to get connected. We have support groups all around the county that they can find out about and participate in. So at children'shome.org, they can go to the Kinship support page, and there'll be a lot of information there as well.
Okay. Now, how does this type of caregiving impact the grandparents? Let's go into this.
Yeah, I mean, you know, as Tara mentioned earlier, we see grandparents who, you know, they want to step in. Sometimes they think it's only going to be temporary, but many times it may turn into 6 months, a year, or a lifetime for the kids that they're raising. So they might have thought, okay, well, temporarily I can bring the children in, we'll figure out what to do in the meantime, but not realizing that school's starting and I need backpacks and I need school clothes and I need school supplies and, you know, I need to get them to the doctor for, you know, an exam so they can get entered into school, and not have the resources, insurance, the finances to meet those basic needs. And many of our grandparents that we've seen are at or below the poverty level already without even taking on those kids.
So needless to say, these grandparents are overwhelmed.
It's very overwhelming when, you know, we have a grandparent that we had worked with and was a part of the program where she was taking care of 2. She went to Tennessee where the state up there had contacted her to pick up some other grandchildren and came back with 6 in total.
Wow.
And then when she got home, realized, oh my gosh, now what do I do? You know, I really wanted to help these children, but now how do I manage the needs for 6? Where do they sleep? How do we feed them? How, you know, and then they all come with maybe some of their own issues that they have to deal with, from academic issues, figuring out what they need, counseling,
and mentoring. A lot of them need mentors because they haven't had stable adults in their lives. So we partner with a great deal, you know, a few community organizations such as Big Brothers Big Sisters, Barrier Legal, to help with legal services in order for them to get temporary custody or even permanent custody or even power of attorney. So a gamut of things to assist them with in order to make their life a little bit easier.
You know, like as I stated earlier, you know, that's my background in social services, and, you know, 30 years ago, especially when they had this big drug epidemic going on where crack cocaine came into, you know, there were so many people that lost their families because of, you know, drug issues. And a lot of them were imprisoned because of drug issues and what have you. And a lot of these grandparents stepped in, you know, but it wasn't as easy as, well, and I don't guess it's ever easy, but it wasn't as difficult as it was back then, because a lot of these kids, you know, because of those issues with being imprisoned or what have you, those kids were taken away and they were put into the system. And then, you know, that's when grandparents stepped in, but it was, you know, the kids within in the system. So, you know, they did have access to some services, you know, but now a lot of grandparents, these kids don't go into care at all.
That's right.
And so a lot of times these grandparents don't know about the different services that are available. So how do you all get the word out, and how do you educate these grandparents?
Well, I think, like you said, part of it is we have to also educate the system of community providers. So we do a lot to go out and outreach to the schools. We did guidance counselors, social workers. We talked to the child protective investigators to say, if you're going to place with a relative, make sure they know where those resources are, how to apply for benefits. And if they need that extra helping hand, find us and we'll be able to go right into the home and provide that hand holding to walk through some of those things and make that job easier. But we have to do that all throughout the community to make sure people know about that, and then get in front of the grandparents, because many times they have no idea where to reach out and find those services.
So do you all, you know, there are a lot of community events throughout the year in St. Petersburg alone. So do you all try to participate in those events, like putting up booths, getting that information out that way? And I think that I've had you guys out at Family Fun Day, Kinship Care, to set up a booth to talk about, well, to get out, disseminate information about the services that you provide. You know, you have advocates. Do you have grandparents who are out there who are advocating for Kinship Care? How does that work?
Yeah, we have.
We have a stakeholders group, and they are going out and doing activities and meeting in order to get find ways to get the word out about kinship. And that's a group of grandparents and relative caregivers that meet once a month.
In addition to that, we have, and which is rare for even most kinship programs, we actually have half a dozen grandparents and relatives hired working in the program that are out there, you know, helping other grandparents and saying, look, I've walked in those shoes before, I know what you're dealing with, here's the path to deal with these issues, we know there's a brighter side down the road, and you know, we've had that experience, so it's really, you know, fun for us to be able to really make that a part of the service that we offer.
And that's what I was getting at, because I think that you know, a grandparent who's doing this, have that experience, who's been through that, could, you know, what better advocate could you have, you know, that's out there doing that for you.
That's right.
How, when a grandparent come to you and, you know, they're frustrated, what is the procedure that you take them through to put them in contact with different services that they may need? Because, you know, a lot of times, you know, it's food, it's financial, and I don't know if they would they qualify to get any type of financial assistance from the state. You know, how does that process work? To kind of walk us through that.
First, we go out and first there's the intake over the phone. We get their information, and then they're assigned to a case manager, a family support coordinator that comes out to the home. All of the meetings are done in home. They never have to leave their home in order to meet with us. We will come out to the home to do whatever is needed to do. And we go into the home and assess their needs in the beginning. After we determine if their need is food, then normally we will try to assist them with food. If we can't put them in touch with a food bank or a church or somewhere that gives food daily, then we will give them food. So we try to connect them to community resources first, and if there is not a community resource that can meet their need immediately, then we will meet that need immediately.
And I was just going to add, you were mentioning, you know, how do we help them with the public benefits? You know, we could sit in the home literally with a computer and log on to the state's website and apply for those benefits. We have a liaison with the state that says, look, if we get stuck or we have a challenge with why this grandparent's not receiving benefits, we can call them directly and streamline that process. We've created a lot of relationships to help streamline the main issues that grandparents are dealing with, which is those finances, legal issues, dealing with the child welfare agencies, dealing with the schools. So we know those kind of particular needs, and when we partner with those agencies to really break down the barriers, because grandparents have come to us so frustrated that I had to deal with this system and that system, and nobody could help me, and I didn't know who to talk to, and they want to throw their hands up. And we've seen, unfortunately, over the years, many grandparents call the state and say, look, I can't do this. And there's no need for that. When they come to us and they participate in our program, 99% of the time, those children are never going to enter into licensed foster care.
And isn't it cheaper for the state to give assistance to a grandparent who's raising grandchildren rather than to put those children in state custody?
Oh, absolutely, absolutely. I mean, I think the average cost just for the case management with the state is like here in Pinellas would be about $11,000 a year per child, just to take care of that child. And if that child, for whatever reason, ended up in some kind of group care, it might cost the state $40,000 to $100,000 a year for the care of that child. Where if we place them with a relative, they get to stay with their siblings, they get to stay in their neighborhood, they get to stay close to their church and their schools that they've always been a part of. It makes a huge difference all the way around.
Now, realistically, there are some issues that grandparents face. All grandparents aren't destitute to a certain point. You know, they may be employed, but they're taking on grandchildren. So there are, you know, they're getting by comfortably taking care of themselves, but take on a couple of grandchildren. And they still need assistance. How frustrating and how difficult is that to grandparents to, you know, get involved with the state to access some of those services? They may come in to say, you're making too much money. We can't help you.
Right, and one of the main issues that we've seen is daycare. You know, many of our caregivers, they used to be 60 plus, so they were retired, they were at home. Now what we've found is that they're 45 to 55 years of age, working grandparents.
Exactly.
And so child care assistance is a huge need because now they have to have a place for the kids to go while they're working and still maintaining that level of income, because they're not going to be eligible for some of those other types of assistance that, you know, other folks may be because of the income barriers. So that's kind of what we try to look at. We'll do a budget with the family. We'll try to navigate some of those other services to make sure that we can balance out the budget to make it work most effectively for the family.
Yeah, because daycare alone could cost a family, you know, depending the age of the child, $400 to $500 a week.
Oh, easily.
And that's a week. You know, so it's very difficult, and that kind of like is a shock to the system whenever you take on. You want to do the right thing, and you want to keep take on the care of your grandchildren because you don't want to see them in foster care.
That's right.
You know,
but the families also get the child-only TANF, which is $180 a month, which is nothing in the grand scheme of things, but it will help those system, and that is child only, so it's not based on their income.
So for that, you know, only around the country, only about 10% of all kids are receiving this public benefit that's available to them. So grandparents oftentimes don't even know they're eligible. They don't know how to apply, and they don't know how to manage the state application process, which can be somewhat lengthy. So we do a lot to try to work with them to educate them so they can have that small benefit that will alleviate some of that financial burden that they're struggling with to meet that extra need that they didn't plan on.
Now, a lot of these things are done over the internet, computer, and what have you. And you know, contrary to belief that every home has a computer, that's not true. And everybody knows how to operate one. So. Years ago, everybody had to file down to the state office, to get these services. So what if there's a situation like that? You know, that I don't have a computer, I don't know how to operate a computer. How do I get these services? Can you still qualify over the phone? Will they take your application over the phone?
The state will still take a paper application. Now, it will take a bit longer to get processed, but again, once they reach us, we're going to make sure that they can connect up at one of the neighborhood centers to get on a computer, to where there might be some assistance, or we can sit down with them and help them walk through the process. And even for the professionals, it's not that easy.
Now, both of you work for the Children's Home Society.
Children's Home Inc.
And Children's Home Inc. Tell us about the Kinship Cares services that the Children's Home provide.
So as Tara was mentioning, you know, we do that initial assessment of all of the family's needs. We can provide in-home services for up to 6 months, and then we have these wonderful support groups that are happening all over the county that they can participate in. Some are educational, some are family fun activities, and what it does is it alleviates, you know, the financial burden to, you know, take the kids out and do something fun, have a meal together, meet other grandparents and other relatives that are doing the same thing, and learn from each other, because many times they're embarrassed. They're not sharing this information with anybody else, and when they meet other caregivers, it's like a whole new world of support that they can get, because now they're seeing, I'm not the only one doing this, and it's not embarrassing. You're doing a great service to the kids and to the community to be able to do this, and we want to do the best we can to support them. So and they can participate in these support groups for as long as they'd like. So there's no disconnecting from the service. They might not even need us to be in the home for that full 6 months. But some families, you have a caregiver who's got some health issues. There's a variety of different challenges that we can stay with them. And then if there really are some additional needs that we're struggling to meet, again, we're going to link into some of these community partners to try to help out. Like we were talking about mentoring. We also have a respite provider that can come in and give grandma 15 hours off a month to get on. Grandparents oftentimes forget about their own health, right? They don't go to the doctor. They won't take care of themselves. So we'll put in those respite hours, and then they can go take care of themselves.
So that used to be a big thing back in the day, respite. But it's still very valuable and valid right now, because you do need that break, you know, only if it's for a few hours.
And some of the grandparents that we're seeing, many of them are single grandparents, many that are have health issues and maybe even disabled, and so they're not, you know, and then like you said earlier, they might not be just taking care of one child. We have some that are taking care of 4, 5, 6, or even 8 grands, and maybe even a great-grandchild.
Yeah. You know, I sit on the board at the St. James B. Sanderlin Center, and there used to be a group down there called Grandparents Taking Care of Grandkids.
That's right.
And those ladies were phenomenal. I mean, not only did they take care of their grandkids, but, you know, they would volunteer for all kinds of different events. My Family Fun Day used to volunteer for that. They used to serve the food. I mean, they did a remarkable job. I mean, and it's like, where did they get all of this energy from?
That's right.
You know, they were just remarkable. Now, the children's home is located in Hillsborough County.
We have a physical group home in Tampa. We have offices in Pinellas County.
That's what I was going to ask you. You have a satellite office here. Where is that located?
That's in Clearwater. That's off of McMullen Booth Road, just north of Ruth Eckerd Hall.
Okay.
But we serve from Tarpon to South St. Petersburg. So there's really nowhere that a family wouldn't be able to get support in our service.
Right. I know that you're all over, because, you know, I think I met you at the Wraparound Services meeting. And that's a wonderful opportunity to connect with different organizations that you may not even have known that is around. So, you know, in that way you can plug in your grandparents to those different services. You know, they have all kinds of different events. Every year, the back-to-school care fairs and what have you that grandparents can take advantage of, and getting school supplies and what have you. Have you seen the list from the schools for the school supplies?
Oh my gosh, I just picked one up. I just picked one up yesterday. It was extensive.
Yes, it is.
Longer and longer every year.
Every year. I mean, not only with what you have to buy for your own child or grandchild, but you also have a wish list from the school that they want you to provide for the whole class or the whole school.
That's right. Hand sanitizer and paper towels and tissues.
It's just really, it's an impressive list, to say the least.
That's right. Yeah, so we've been connecting up. We have our support group assistants put together this tremendous newsletter every month for our caregivers. So we load it up with all these community resources and the happenings around Pinellas County to get plugged into some of these events and things. So they oftentimes are letting us know about things to share with one another. So, and like you said, the groups together have so much energy and get so much from each other that, you know, they want to do more. And so, you know, we've had some over the years go with us to Tallahassee and talk to legislators. We've gone up to Washington, D.C. last summer to, you know, talk to some of the state
They're the best advertisement you can get.
Absolutely.
And advocates that you can get.
That's right. That's right.
So take us through the steps that a grandparent need to do in order to connect with your services. How do they call you up on the phone and say, I need help, what do I do?
Well, right now they could either call self-referral into our line that Larry gave you, or they can contact the guidance counselor at school or school social worker. Or if they see us out at an event, they could say, you know, I would like to be a part of your program, and then we'll contact them and start the process. They can also go to Daystar and let them know that they're looking for kinship programs, and I pick up those referrals on Wednesdays and usually do the intake over the phone with them.
Yeah, so any community provider can call us. There's no fees, there's no waiting list, there's no wait time for a family to get service. So as soon as we have a phone number and an address, we can run right out and, you know, start putting those things in place, because we know sometimes the families are in crisis. And we really want to make sure, like Tara said, you know, sometimes it's food, you know, those basic needs at the end of the day that we have to, you know, bring out there on an emergency to help a family out.
Yes, basic. Kids eat a lot. They do, and the older they are, the more they eat. So, and you know, food is not cheap. So I could attest to that. Probably being one of the, because you know, my grandparents, my grandkids, you know, when they come to visit me, it's like, where do you guys put all this? You know. Okay, so we're gonna be wrapping up now. So give us that website again and your phone number?
Sure. The intake number is 1-888-920-8761. And so they can call that number and get connected. And then they can go to the website, which is www.children'shome.org. And they could send us a contact through the website. They can get the information. The contact information is all posted there as well. So we really want it to be as easy as possible for families to get linked in and make it a really easy process for them.
We also have a Facebook page as well, so if people want to get in contact with us that way, they can.
Great. And I think you sent in some pictures, so we will be, we've shown those throughout the show here, so people can actually put a, their memories to and faces to the pictures that they see and what type of services that you do provide.
And TAR's got a great event coming up, this in a couple of weeks. We got National Grandparents' Day coming up the first Sunday of September.
And
so
that's every year the first
Sunday every year in September. And so we have 4 celebrations.
Right. We'll be at the Sanderlin Center on September the 8th, and Lellman September the 5th. Also, we'll have events in Tarpon Springs and Safety Harbor.
Okay, and those are usually in September.
Right.
Okay.
That's right.
Every year.
Yes.
Okay, great. Well, thanks again for joining us today. If you would like more information about Kinship Care, here is the contact information and website. Please join us again next time on St. Petersburg Together. Thank you very much for joining us today.
Thank you.
Appreciate it.